Chiropractor, and today we're here with my medical massage therapist, Clay Hennard. Now, I don't give plugs like this usually, and you know that on all my treatment videos that I do, but Clay is my massage therapist, and he is very, very knowledgeable and specific when he works on someone. First time he worked on me was over 3 hours, and I had a herniated disc, re-herniated disc in my lower cervical spine that was shooting pain down my arm for the first 3 weeks after we went parasailing in the Bahamas. So I was getting adjusted, it was feeling better, but my arm pain was still shooting down my arm. After Clay worked on me the very first time, I had no more arm pain and haven't had it since. And I recommend my patients to go see him, and Clay actually referred in Eve, who referred in her husband Brian. So we're now just a big referral family, and I would recommend to anybody that lives here in Houston, or even if you don't live in Houston, if you come here for treatment, that you see Clay as well as myself. His phone number is 713-516-2365. That's 713-516-2365. Is that correct, Clay?
Yes.
Great. So now you're going to see me get work on Clay, and then I'm going to let him give a little talk about what he knows about everything. Okay, not everything, but let's have you flex your head forward and backwards for me. And then in neutral. Okay. Now he's already getting much better posture, but he's a side sleeper. You can tell his head's always turned to the left a little bit, and he's translated a little bit to the left, which is bringing his right shoulder a little bit higher here, so I suspect he's sleeping on his side with his head turned that way most of the time, because his arm's out front here too. Exactly. And in the mirror here too, also we've got the pelvis translated to the right on the x-axis. That's a negative SX pelvis. But other than that, he's doing good. So we're going to decompress him first today. Go ahead and get you back there for me. Clay has already referred us a lot of patients that he takes care of, and you actually found me on YouTube, didn't you?
Yes, I did.
And you were researching Kyphosis for one of your patients, Eve, who we just did a video on. And you referred several other patients to us as well, and now we're both taking care of them, so they're getting double good care. Clay's as good a massage therapist as I am a chiropractor. And I'm not trying to brag, I'm just being factual. He's very knowledgeable, and he's had extra training in medical training for massage therapy on the origins, insertions, actions, and innervations of muscles. Take a deep breath through your nose. There we go. You notice how I always get down. It's very important when you do this. Don't be trying this at home, by the way. Don't be making your own table and practicing on your family members. We've had a few people I've seen do that, and I do not advise that. This is should only ever be done by a trained, licensed chiropractor. Clay doesn't even try to adjust people whenever he massages, turn you sideways and come over here now, Clay. He doesn't manipulate or anything. See, he does what I don't do, and I do what he doesn't do, so we make a great team.
I second that.
Yes, there we go. The left leg is short on him by about a half an inch, a little over half an inch right now. But see how it gets even right there? And you also notice his knees stop right there too, because he has some knee problems, and his pelvis tightens up right there too. You see that raise off the table? That did tighten up right there, didn't it, Clay?
Yep.
Yep.
Had a knee replacement there.
Yeah, he had a total knee replacement on which knee? The right one?
Right one.
Yeah. But we still adjust it. I feel steel and what's the other material they use?
They have an alloy.
The alloy and titanium. That's what I'm looking for. And I think they also have some kind of softer, rubbery kind of material that they use for the surfaces, don't they? That fits on the surfaces of titanium? Or is it just titanium on titanium?
Oh no, it couldn't be that.
Yeah, it's got some kind of of a dense kind. It's not liquid. It's kind of more like some sort
Like
of
a Teflon.
plastic, Teflon or plastic kind of material that slides. We've got several patients that have had total knee replacements, and we adjust their knees, and they feel better all the time too. But when you've had any kind of surgery anywhere, you're going to have scar tissue development, and you're also going to have, there we go, we're also going to have decreased range of motion, not only in that joint, but the joints that are compensatorily being affected.
Thank you.
Yeah, got good movement on his foot there. His feet's been doing better.
Yeah.
He's on his feet too a lot, so he gets a lot of stuff going on with his calves and his feet as well. And see, Clay, he gets deep on everybody else, and then I get deep on him. Only I cheat a little bit. I use the Turbonator on him. Yeah, can't take too much of that. That's pretty significant, huh? You felt that one too, huh?
That
When I was
feels
doing
really
the
good,
turbo
yeah.
there on the ball of your foot. Yep.
Oh, I needed
Oh
that.
yeah, everybody does. Okay, I got you here. There, okay, just drop your head right in my hand. That's always good. Then we'll stick my elbow in his levator scapula right here, though. Boy, that's tight. See, he gets a little of his forward head posture and a little bit of kyphosis in his spine because he's bent forward working on people all day long, too. So that's why it's important for us to get each other worked on. I mean, I got adjusted this morning exactly as I adjust patients from another Houston chiropractor who I taught how to do this very same technique on me. He was already a talented adjuster. You can tell when somebody's got natural talent. It's kind of like being a natural football player, quarterback like Joe Montana, or receiver like Jerry Rice, Andre Johnson. Those are all natural athletes. Brett Favre was a natural athlete, quarterback. They still practice. I'm still practicing. 33 years now out in Texas. There we go. Yep, that's pretty sore in your rhomboids today too. Okay, let's turn you on your back now.
Working today.
Yeah.
No in the yard.
Oh, so you're doing some extra duty, so that's the one on your back. There you go. Drop this one right in there. Put your hands right on your tummy there. Okay. Okay, tilt your head left a little. There you go, better. Now it's better. Okay, now. Here's his right knee. This is the one with the total knee. Now watch how loose this is. Look how much play is in that, and you can even hear that. There we go. Now see, I adjusted his knee, which will tighten up the ligaments on the interior side here, which is the medial collateral ligament, and then the lateral collateral ligament on the outside. But it also went all the way up into your low back there, didn't it, Clay?
Yeah.
Good.
Actually, there's a pop in there.
Yep. Usually moves right at L5S1, which is the sacrum and L5. Now see, this one doesn't move as much, but it's still got some play. Nope, that wasn't it. Yeah, that was better. I can tell when I get them and when I don't get them. If I don't get them, I hit them again. the right way. You know, all this is really a art. So you gotta feel things and catch them on the right inspiration or expiration and adjust them according to their own individual needs. I think that's what most of our patients love about us versus seeing the other chiropractors that they've seen, is that I do everything from get to go. I don't just see you for a minute or two and then send you off to a therapy room.
Man, you're right on.
Yep. This is Tibialis Anterior, and I'm doing a muscle spindle technique on that right now to loosen that up because that's very tight. And that's right below his knee. Right knee surgery. Okay, let me help you up sideways, Clay. Just kind of swing towards your knee. There you go. Good. That's the way you should always get up, sideways. Let's get back this way a little bit. Look straight ahead. He's got surprisingly good crepitus-free range of motion in his right shoulder there. As much massaging as he does. It's usually pretty tough on the hands, wrists, elbows, and shoulders. There we go. Good. I'm adjusting the glenohumeral joints there. And also, as I was doing that, I pulled his bicipital tendon back into the groove as well. So he's in the groove now. There we go. That's it. Okay. He's a strong arms and hands as well. You get strong arms and hands whenever you do what I do and do what Clay does, just from working on people all the time. How many years you been doing this, Clay?
Since 1992.
1992. But he's got more experience and more knowledge than any other massage therapist I've ever worked on. Clay, if you don't mind telling our YouTube audience a little bit about how you came here and what you've seen since you've been here, like that story you told me last week on the phone when we were going home.
Well, the way I ended up here is I had some patients that needed some help. They had kyphosis and another person had scoliosis, and I had a hard time finding a chiropractor who could actually help in those two areas. So I needed a chiropractor who could support what I was doing. So I went on to the internet and I put in kyphosis cure, and Dr. Johnson's website kind of popped up, and so I took a look at his YouTube videos. And the first thing I thought is, no chiropractor's ever done that for me. Not that extensive and spend so much time. So I came up here to check him out so that I could go ahead and refer my customers to him.
Yes, and you have, and we thank you for that. He is just excellent. So I'm telling you, if you live in Houston and you want a really thorough, medically superior type of massage, Clay is the man to call. Give me your number again, Clay.
713-516-2365.
There you go, 2365.
And if you need a very good chiropractor,
Thank you.
then you need to see Dr. Gregory Johnson.
Thank you very much. All right, my friend, let's come over here and shoot you now. That's the testimony. All right. We call this shooting, people, but what it really is a high velocity, low amplitude adjusting instrument that is a very specific tool that I use for postural correction on the X, Y, and Z axes. And you'll see what I'm talking about here. We're going to mirror image him, so we're going to have him lift shoulders up, back, hold hands back. Now, not only are we going to pull his head backwards in the Z plane, but we're going to rotate it on the Y-axis to the right because he was to the left. And then we're going to adjust that atlas on the X-axis while he's in a mirror image posture. And then the message is going into, so you can relax now, into his cerebellum that controls balance, posture, coordination, and all movement. We'll start remembering that. So let's have you flex forward and backwards again. That was much smoother and straighter. Yep, that's great. Take a look now. So you're not nearly as rotated, much more even right here. Shoulders are level. Yep. Excellent. So this is your Houston chiropractor and your Houston chiropractor's massage guy. We'll see you next time.
Bye.